Hello, my name is Dr. Saundra Jain, and I'm a psychotherapist in private practice. In addition to that, I serve on the steering committee for U.S. Psych Congress. In fact, this is my third year to serve on the steering committee. So today we're going to be talking about the value and importance of using psychiatric scales and screeners in our clinical practice. This is such an important and interesting question. I'm sad to report that most healthcare practitioners aren't routinely using scales and screeners in their clinical practices. And I wish there was a simple answer to this question, but the truth of the matter is there are a lot of variables at play. The one thing that I hear the most commonly when I talk to clinicians about using these tools is this: I simply don't have enough time. That's a biggie. But there's also issues around cost, access. Where do I find them? How about lack of familiarity, just not knowing about what's out there and available to us as clinicians? And there's actually one more that I should mention, and that is a bias that some clinicians have against using a screening tool or actually engaging in a structured interview. So those are some of the things at play. Now let me tell you about a conversation that I had with Dr. John Rush. And this is someone that I'm sure you're familiar with because he was a lead architect for the STAR-D study. And he said that when he did an informal polling of psychiatrists in his audiences, this is what he found: that less than 10% of psychiatrists are using any type of measure to assess for outcomes. So less than 10%. But listen to this: less than 5% in his experience were actually using any type of structured interview in the path toward making a diagnosis. So I'll say this: based on Dr. Rush's experiences, based on my experiences and my colleagues' experiences, and I'm sure many of your experiences, it is so important that we today are having this conversation about the value of using psychiatric scales and screeners in our practices. Well, let's start by pointing out that scales and screeners are not diagnostic instruments. They're simply one step in the process of gathering information as we begin putting together possible diagnoses. And there are other steps that all of us as clinicians are using routinely. Those include comprehensive clinical interview, longitudinal history, collaborative information. How about family history, to name just a few? But let me tell you the way I like to describe psychiatric scales and screeners. This really resonates and makes sense for me. I view all of them as great safety nets. That's it. Safety nets that help us as clinicians really avoid the mistake of missing critically important clinical information. And one other thing I do, I'll ask a patient to complete a number of different scales and screeners. But when I have access to family members, spouses, anybody that's close to my patient, obviously with my patient's consent, I will ask that family member or friend, whomever it may be, to also complete the scale and screeners that I've had the patient complete. And I ask them to complete it as if they were answering it as if they were the patient. So from that viewpoint. And two interesting opportunities arise when I do that. The first is, oftentimes it unearths or uncovers really important information that I would have completely missed without their input. And the other thing is this: when there is a discrepancy between what the patient's reporting and what the family or significant other is reporting, wow, that is an opportunity to open up a dialogue about those differences. And again, it really serves as a safety net to, again, make sure that we're not missing critical pieces of clinical information that will definitely help us in making an accurate diagnosis.